Hi, my name is Mithota. Today I'm presenting a poster of a case study related to a grad year nurse, Gabrielle, and needle stick injuries which she went through during managing her patient, Mr. Stan Walker. Mr. Walker is a terminal stage liver failure patient related to hepatitis C. The aim of this poster presentation is to highlight and discuss the risk management and quality improvement strategies relating to case study 2. First of all, I'm going to discuss about factors which has induced errors in this scenario, which includes human factors, system factors, and communication failure. I will use three buckets model for risk assessment and fishbone diagram to analyze quality issues. I will also discuss clinical governance strategies to improve quality and staff safety, and various interventions to mitigate risk, and finally, quality improvement models pertaining to the case. There are multiple human errors which comes under human factors such as fatigue, long night shifts, inadequate planning and execution to remove blockage in IV line, cannot remember protocol for the management of needle stick injuries, unaware of the complication of exposure and risk of communicating infectious diseases on exposing to infected patient's blood, use of needles rather than interlink for irrigation, forgetful of safety and equipment check, neglecting the PP such as gloves and masks in high risk patients, forgetful of taking flashlight into dark room, and she was in hurry to address the issue. Some other factors are related to system factors such as busy ward, poor staffing, bad lighting, lack of adequate equipment, and poor supervision and leadership. The barrier identified between Gabrielle and her colleagues and senior staff are busy ward and lack of time. Attitude of being perceived as incompetent and unsafe by other in team. Assumptions and wrong conclusions on part of Gabriel with communicating effectively about the incident, and lack of teamwork. Teamwork could have mitigated the incident. It helps to coordinate care and increase stress among the staff and improve clinical performance and minimize errors. Now I'm going to talk about risk management strategies, which helps to understand risk prior to task initiation and implement safety measures in place. Three bucket model for risk assessment at workplace includes self, context, and task. Fatigue, long hours, lack of confidence, and poor communication skills comes under self category. Text includes night shift, equipment, dark, busy environment, and poor teamwork and support. Task is it covers components such as shortcut, lack of PPE, safety and equipment check, agitated patient, and alarm. I'm applying Ishikawa's fishbone diagram using cause and effective analysis. It measures quality issues which are place, people, procedure, and policies. Place such as poor lighting, poor staffing, and noisy environment. People who are doing long hours, it's fatigue and lack of knowledge and supervision. Procedures such as shortcut, not following safety guidelines and procedures, and lack of equipment. And policies like cannot remember protocol, inaccessible colleagues, and supervising staff and poor communication. Now I'm going to speak about interventions to mitigate risk and quality improvement by using clinical governance strategies which are promoting quality and safety as priorities in workplace, education and training. It helps to improve and refresh basic skills and knowledge. This is an essential part of clinical governance in to prove the quality of care. Openness. It is very essential in workplace to have openness in communication about the errors performed while administering clinical care. This created an environment for open discussion and reflection upon the mistakes and prevent them to be repeated again. Equipment maintenance and replacement schedules. In this scenario, there are no interlink devices at the bedside needed for unblocking the IV line. Gabrielle didn't perform safety check prior to starting her shift, as this could have prevented this error. Workforce planning. This allows staff scheduling to prevent increased workload on the staff and prevent errors in judgment and clinical care. And clinical audit. To review clinical performance against a set of standards. The standards may vary per organizations. However, all clinical audits procedure produce a report that provides an overview of clinical performance. At last, I'm talking about PDSA model, which measures effectiveness of above implementation. There are several quality improvement tools and frameworks available that an organization can consider to promote excellence. A commonly used model is PDSA, where P is for plan, is to identify an opportunity to improve and plan a change or test how something works within one component of the clinical workflow, including establishing metrics to assess progress how the goal. D is do, is to carry out the plan improvement for specific components of this clinical workflow. The test period may be as short as 1 day and be implemented on a small number of patients. S stands for study, which examines the results, and A stands for X. Based on the results of the testing period, incorporate changes and establish quality improvement plans. Thank you.